Hi, welcome to the final episode of this series about the 2030 agenda. Today we will explore a different angle. We will not talk about the story of the agenda, the goals, or the indicators. Instead, we will focus on the real case that shows how difficult it can be to reach sustainable development when country faces a deep political social divisions. My topic today is not one of the most controversial and emotional issues in the world: abortion and reproductive rights in the United States, and how this conflict reflects the change of the 2030 agenda. This episode is not about personal opinions or moral debates. It is about health, equality, human rights, and policy decisions, all key elements in the Sustainable Development Goals. Why look at the United States when talking about the 2030 agenda? When we talk about a global development, many people assume the biggest challenge are in poor countries or in common places with less access to resources. But the United States shows that this is not always true. The US is one of the richest and most powerful countries in the world. It influences global policies, economy, science, culture, and diplomacy. However, it also has some of the largest ministerial equalities in the development work. This matters for several SDGs, including the 3, good health and well-being, the 5, gender equality, 10, reduce inequalities, 16, peace, justice, and strong institutions. In this episode, we focus on one issues where these goals calling access to abortion and reproduction health service. Abortion in the US and strongly between policies, health, and equality. For almost 50 years, abortion was a protected right in the USA, in the United Nations. But in the 2022, the Supreme Court ending Roe v. Wade, meaning abortions was no longer protected at the federal level. After that decision, each state created its own rules. The result is a country divided into realities: states where abortion is legal, safe, and accessible, and states where abortion is banned, even in cases like rape and dangers for the mother's health. From the perspective of the 2030 agenda, this creates contradictions. Why? A high-income country moving backwards in areas where many other countries are progressing. Actually, abortion is not only a personal or moral decision. It is connected to health, rights, economy opportunities, and gender equality. Research shows that banning abortions does not reduce the number of abortions. It only makes them more dangerous. And the first big inequality appears here. In the United States, access to abortions depends on where you live, not on medical needs or health risks, but simply on your zip code. This creates a system that contradicts the idea of leaving no one behind. Well, and the biggest question here is, how do abortion restrictions affect the SDGs? To understand this, we need to connect the issue to the goal. Without repairing theory from previous episodes, the SDG 3, health and well-being, abortion restrictions affect maternal mortality, emergency medical care, suffering during pregnancy, and the mental health. The US already had one of the highest maternal mortality rates among wealthy countries, and now the numbers are rising even more in states with strict bans. The SDG 5, gender equality, includes the right to make decisions about one's or body. When that right is taken away, women lose control over education, career, finances, their life plans, and physical and emotional safety. This creates a deeper social and economic inequalities. The SDG 10 reduce inequalities. Restrictions affect vulnerable groups the most: low-income women, teenagers, women of color, migrants, women without health insurance. Inequality becomes strong and harder to break. The SDG 16, strong institutions. When courts and states fight over rights, trust in the system decreases. Polarizations grows and political tensions make it harder to build fair and stable institutions. A country divided, two Americans living under opposite laws. After the end of the Roe wave, the US became a map of legal contradictions. In some states, abortion is a normal part of the health care. In others, women cannot receive medical help even when the pregnancy is dangerous. These contradictions created a serious consequence. Women traveling long distances to get medical care. Clinics in safe abortion states overwhelmed with patients. Doctors afraid of criminal charges, and pregnant women the need treatment in emergencies. This shows something important about sustainable development. It cannot work when rights are inconsistent or unstable. A country that sends brokers to space struggles to guarantee a basic rise to its own populations. This station is in the center of today's discussions. Who suffers the most? The impact on you on vulnerable groups. Actually, aversions restrictions affect the entire society, but not equally. Teenagers. Many teenagers cannot travel to other states, do not have financial support, have limited access to sexual education, and face strong social pressure. A pregnancy at young age had long-term consequences on education and mental health. Migrant women, many lives in states with the strong restrictions. Some do not have insured or fair seeking medical help because of migration's status. The Black and Latin women, they already face higher rates of poverty, actually discrimination in healthcare, pregnancy, complications in lower quality hospitals, restrictions increase their health risk even more. From the SDG perspective, these wines exist inequalities. What do these reveal about the limits of the 2030 agenda? Here we arrive at a difficult but important point. The SDG are global goals, but countries have the power to interpret or reject them. The United States case shows three major limits. One is development is not always process. A country can we reach and still go backwards in human rights. Money does not guarantee equality. Sustainable development also requires political concessions, strong institutions, accessible in healthcare, public trust in science. Without this, even wealthy countries fail. And the number 3, the SDG cannot override national laws. The UN cannot obligate any country to follow a specific policy. It can recommend and encourage. This leaves a question in the air. What happens when a powerful country goes against a global human rights standards? But what is the role of the media narratives, misinformation in social conflict? In the US, public discussion about abortion has become extremely polarized. Media sources present the issue in completely different ways. Conservative media frames abortion as a moral crisis. Progressive media frame it's a health and right crisis. But science use emotional language. This affect how people see the issue and how they vote. But misinformation has consequence. More fear, more divisions, less struck in doctors' decisions based on ideology, no evidence, and without accurate information, the SDGs cannot be properly monitored or measured. Now, the psychological dimensions living in a constant tension. One aspect that is often ignored in the emotional impact, the constant fear behind the need medical creates anxiety, depression, stress, advance of hospitals, social isolation. Actually, the agenda promotes mental health as a part of the well-being, but this is possible when risks depend on political battles. Why does this matter for the global community? Actually, the United States influence the work in many ways. Politics, other countries follow its example. The follow Roe wave encourage anti-abortion movements in Europe and Latin America. Cultural Americans films, TV shows, and celebrities shape the public opinion worldwide. Funding, the US is a major donor to international health programs. Changes in domestic policies affect global initiatives related to women's health and diplomacy. International negotiations on gender health and rights become more complicated. Now the future. What does this mean for 2030? The reality is clear. The United States will not meet the reproductive health targets of the SDG 3. Gender equality goals will remain income. International equalities will continue to grow. Political polarization will keep shaping health policies. But this is not a measure of failure. It is a reminder that sustainable development depends on social cohesion and human rights, not only on money or technology. Finally, across these three episodes, we explore different dimensions of the 23 Agenda, its origin, its 70 Sustainable Development Goals, and the goal change that still slow the process. Each episode highlights a different aspect of the agenda, but together they show the same structure. Achieve sustainable development is complex, uneven, and deeply connected to political, social, and economic realities. Despite these obstacles, the 23 Agenda remains a vital global commitment. Is not only in the framework of governments, but it calls for awareness, responsibility, and actions for all of the us, understanding and questioning these issues is the first step towards meaningful change.